Peter.
I'm having trouble keeping any video on. I'm just getting kicked back to audio all the time.
Oh, let me see if I can turn on your...
To reduce this as well. All right, so just a couple housekeeping items. We will have a Q&A period at the end, so please do hold your questions until that time. We'll take verbal questions, so you can just kind of pop in, unmute yourself, and ask questions. Or if you don't feel comfortable speaking or your microphone isn't working, you can always type your question and Kelly will alert me to any questions that you're putting in the chat box through Zoom. So I'll get us started. So as Professor Kern mentioned, this presentation is about my experience managing and supporting a project based in Uganda. It was based on school retention, resulting in HIV prevention. So we know that when adolescent girls stay in school, they do have lower HIV rates. There have been a number of studies for that. So it's for HIV prevention ultimately, and we manage the school retention through early warning systems. So you can see there the donors and partners, as well as World Vision down below. So I'm aware that not everyone is very familiar with PEPFAR. So I just have a quick slide here to introduce you to them if you have not been familiar or worked with PEPFAR before. So it's the U.S. President's Emergency Plan for AIDS Relief. We call it PEPFAR for short, and it's the U.S. government's response to the HIV/AIDS epidemic. It really is something worth mentioning that it's one of the largest single nation contributions to take on a disease. We may be seeing some things that change with COVID-19, but this currently was one of the biggest efforts made by one single government. It was founded in 2003 with bipartisan support, and the current 2020 budget for PEPFAR only funding is $4.89 billion. And then the project that I'll be talking about, along with the research that we did for that project, was funded through something called the Dreams Innovation Challenge. So I have some information up here. I know this is a busy slide, so I won't be going through all of it. But basically, it was a private-public partnership between the U.S. government, the Gates Foundation, and others who put together $85 million to address HIV infections among specifically adolescent girls and young women in 10 sub-Saharan African countries. The purpose of this really was to break a cycle where we saw that the men who were in their 20s and early 30s were infecting young adolescent girls and young women with HIV, and then those young girls and women would go on to have other sexual partners who would then be infected, and the cycle would just continue in that circle over and over. So what PEPFAR really wanted to do is to break that link in the chain of infection by focusing on adolescent girls and young women to allow that link of adolescent girls to be broken by preventing their infection. So you can see the 10 countries there. And then the acronym DREAM stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. So I'll just refer to that as DREAMS. And really the specific focus of this innovation challenge was they acknowledged that there were some gaps around prevention for adolescent girls and young women, and they wanted new partners and existing partners to bring forth some innovative approaches to fill in those gaps from evidence-based models. So they looked specifically at reducing girls' HIV risk, which could include poverty and gender-based violence, as well as lack of education, because as I mentioned earlier, dropping out of school is associated with higher rates of HIV infection. You can see 6 challenge focus areas down below. The one I'll be talking about today, because our program focused there, was focus number 2, which is keeping girls in secondary school, which again is linked to lower HIV rates. And some other partners did take on strengthening capacity of communities, linking men to services, supporting pre-exposure prophylaxis, bridging to employment, and then applying data to increase impact, looking at technology for that. But I won't speak about those. I'll focus on focus number 2. So I'll just show a quick video here. I'm hoping that the audio will come through well. So bear with me.
I've seen a lot of challenges in life. I've never had life peace. I dropped out of school because of poverty. My parents were not able to pay for my school fees, so that just presents how much. I didn't have somebody to support me because I don't have my dad, so my mom is not there. I only live with my grandparents, and they're very hard. I was just home there doing no academic job, but helping my parents with housework. But it's busy that your job partner, they start coming to disturb you. It overpowers me. Those challenges overpowers me. And sometimes I even had the heart of giving up. I was very bad thinking it was that independent.
Identifying that maybe business is about to drop out of school. We did not have such an idea. You could go to class, you make a roll call, and maybe you discover that maybe 2 or 3 students have dropped out. And for us, we thought it was normal.
So we had the feeling that we don't know the reason why this life was not happening. And what exactly the challenges they are facing. My main role is just to educate the world on the importance of education, how to protect themselves, and to be able to example tomorrow.
I had to send it. This is home because I need to experience that.
Irene, have you ever heard about the math?
The goal I set for my life, I had not yet achieved it. That's why it was so wonderful that I come back to school.
We decided to go to the teacher to visit her and find out why she was missing.
My mom was scared because she thought they were just doing extra because of the so we were scared as we, but when she said she was going to bring us back to school, I think that we were now happy.
Overwhelmed by that we are
I feel great, I feel happy. We feel good that night. I'm now more profit in a short time, but still under best competition.
Don't be asked them. She was the best performer.
When the pride is high, the body demanded will be low.
We must help us to ensure that we also retain girls who will be safe, who will not be endangered by HIV or get married at an early stage, but continue with their studies.
I really have great ambitions in my life. I have big dreams to achieve. I want to be now seeing a teacher, but tomorrow I'm not seeing my family somewhere because I've managed to come back to school. From here, we're going to do our short-run marginal course. My dream is to become an accountant. whatever problem they are encountering, they will persevere. They are not left behind because the one does not understand. The one is
prevention and medical information.
All right, I hope that you were able to hear that. I prefer to let the girls speak for themselves as much as possible. So I really do enjoy watching that video, even though I've seen it probably 20 times. So the girls have really spoken for themselves, but I want to present some of the evidence around this project and how we attained some of these objectives and achievements, as well as some of the data that we're able to share out for community practice around school retention for adolescent girls. So currently, we do have a book chapter that's been published on this project. It's currently being produced in a book called Adolescent, Young People, and HIV Prevention in Eastern and Southern Africa, Emerging Evidence and Intervention Strategies. So some of the research that I'll be presenting will be available in that book, but I'll run through it here as the case study is outlined there. So here's kind of an overview of the case study project. As Professor Curran mentioned, it's called the SAGE project, but you can see here the full name and also the evidence that it's based on. So we've seen in previous research that social and behavioral interventions for HIV can address the needs of young people. We know that this is an age where the physical and cognitive levels of people are developing in very unique ways and in an accelerated speed. So looking at social aspects of programming for adolescents is especially important. We've also seen in previous research that using the socio-ecological theory allows to address different levels, for example, schools, communities, individuals, and their families. Leaving out any of these has been demonstrated to be less effective than if you're able to take in this scope. So as we already named it, the SAGE program was a school-based HIV prevention program. And we used an early warning system, or what I'll call the EWS, to track school attendance, as well as to involve the community, including religious leaders, school administration, and others in supporting girls to stay in school. The study that I had mentioned previously, where the data was developed, was a longitudinal study. It was conducted in 13 districts in Uganda, and we did cross-sectional baseline and end-line surveys in 2016 and 2019. So we had 10 intervention districts and 3 control districts, and the sample size you can see here was 1310 for the total, with 950 intervention and 360 control. You can see that we also talked to parents and caregivers, and we had a control and intervention group there as well. And the overall objective was really to assess the impact, to know if this new innovation of the early warning system, the way that we had put it forth, was effective. This project was implemented in 151 schools, and we'll look at the geographic scope in just a minute. I'm presenting results now as the large picture, but I'll get into the model itself and then a broader look at results. But I just wanted to give you a sneak peek here, where we see that we saw that girls who experienced school-related gender-based violence decreased by 7%. The girls who took an HIV test increased by 10.8%. Those having sexual intercourse decreased, and the rate of corporal punishment also decreased by 17.5%. And I'll talk a little bit more about why that those are specifically highlighted in the abstract of the chapter. Really, what we were looking to do, which is very difficult in a 2-year project, which this was over a 2-year and 3-month period, was looking at trying to change social norms or to shift the social norms so that communities and individuals valued girls' education, worked to prevent violence against children, including adolescent girls, and then also looking at alternatives to corporal punishment, and with that, the promotion of positive discipline. So in addition to this longitudinal study, we also saw that we had our own monitoring data for the project where we looked at retention pre and post, and we saw that at the end of the project in 2019, we had a 99.7% retention rate, where the national average is 80.5% for retention. So we can say at least that this data suggests that what we had done was effective. So as you look through the next slides and I present, you can certainly see some of the different elements that may have made this result as you've seen it here. So just taking a step back, so how did we come up with the SAGE model? So first, of course, one prefers to look at different theories or frameworks in order to position the grant or the project to make sure that it will be successful. So as I mentioned, we looked at previous research, and we used Yuri Brofenbrenner's ecological systems theory, which was developed in 1979. And it's been widely used, but it's specifically appropriate for adolescents for the reasons that I mentioned. So looking at individual peers, family, and schools, as well as kind of the broader cultural norms, the educational policies, government policies, et cetera. So looking at all these different levels, you can see that we were addressing a number of these, and I'll get more into detail in how we did that in just a moment. So in addition to using the socio-ecological theory, we also worked from a USAID framework called Positive Youth Development. You can see kind of just a sketch of it here, but essentially this focuses on youth having assets and building those assets in programming, youth having agency, so youth believing that they have the ability to control the outcomes of their lives and use the assets that they have. Contribution, which looks at youth being meaningfully engaged in whatever programming you're doing. So in the design of the program, in implementation, and in evaluation. And then also an enabling environment. So you'll see that a lot of what we did around school retention was developing an enabling environment that would allow those youth to develop assets and use their agency to contribute as well. So that's a big one there. All right, so the project goal, which I already mentioned somewhat, but this really spells it out, is to reduce secondary school dropout. So there are a lot of programs that focus on primary school dropout. That's actually, World Vision primarily focuses on primary school attainment as looking for universal education, at least to the primary school level, because there's a lot of dropout in those age groups as well. But because PEPFAR and this innovation challenge was focusing on adolescent girls, we looked at secondary school in particular. And what was interesting in looking at this is that Uganda and a lot of the other countries under the innovation challenge had data and information in their education management information systems, but they did not have information about secondary school dropout or retention. So it was very difficult to find numbers that would help us to get a baseline that we were working against. I see that as a big gap in that, in the Ministry of Education there, and I think we pointed that out as we worked closely with them on this project. So our initial target was to keep 38,750 adolescent girls between ages 13 and 19 in school, and we worked with 151 schools in the 10 districts that you see here. As I mentioned, it was difficult to find data on retention, and so one of the numbers we were able to find from the Ministry of Education was how many individuals who entered school completed level senior 4, which is 36%. So senior 4 would be the equivalent of your second year of high school. It goes through senior 6 in total before they take the national exams. And then they also looked at the transition rate of how many moved from senior 4 to senior 5, which is only 24%. So that would be going in to your third year of high school equivalent in the US. So those are very, very low. You can see that just in those last 2 years, you have a huge drop off of those who are able to progress. And there's a number of reasons for that. I've already mentioned these, the target and the goal. So here, again, is a quote from an adolescent girl when we were doing our study. And I do, again, prefer to kind of hear from them. So she said, before Dreams came in, we never had a chance to have someone that you can really trust and tell that the teacher is really disturbing me. And just as a side note, disturbing really means to be sexually harassing, either verbally or sometimes also physically. So when they say disturbing, that's often what they're referring to. And then she said, but the help of Dreams, we got teachers and we can really trust, because Dreams brought us teachers that we can really trust, and they brought their faces to us. So at this time, if I get any teacher who disturbs me, I'm fine to go to the focal teacher and say, Madam, this teacher is really disturbing me, and the issue is handled. So this, I think, we chose this quote because it really shows how the girls were educated on how to report things. They were educated that this was unacceptable behavior if their teacher was sexually harassing them, and that they had agents and advocates within the schools that were developed through the program to prevent them going without telling anyone what was going on. So that was one of the things. And just a few statistics, I haven't put them here on the screen, but there is a very strong linkage between gender-based violence, or GBV, along with HIV. And it makes sense because HIV is a sexually transmitted infection. So if you're looking at gender-based violence, there's a clear linkage there. But some of the statistics around that from Girls Not Brides, an organization working on this issue, is that girls with no education are 3 times as likely to marry by the age of 18. So that links the education and gender-based violence. Girls Not Brides also says that over 60% of women 20 to 24 with no education were married before the age of 18. The World Bank states that each year of secondary education may reduce the likelihood of marrying before the age of 18 by 5% in many countries. And then looking at gender-based violence as an issue in schools, UNESCO shows that there's an average of 39% of school principals that report teacher-pupil harassment has occurred in their schools. In Nepal, 14% of school dropouts are attributed to fear of the teacher. And then in Swaziland, 17% of girls 13 to 17 were pulled out of school because of pregnancy. So the list goes on and on. There's a very strong link between levels of education, being able to stay in school, and the well-being of girls long-term. So we did have a gender-based violence component in our program, and I'm just sharing this here, some of the illustrations and sort of the voting techniques that we used with girls while we did the study. So to the left, you see they spoke about child abuse and gender-based violence during this program and how to protect yourself from that. And you can see this was actually one of the more peaceful drawings that the girls produced. There were some very, very vivid depictions of sexual violence, and they really pointed to this as one of the biggest issues that they face in getting to school and staying in school as well. So we asked girls, for example, in a focus group, and you can see that to the right, the reasons that girls drop out, and you see that they're saying that early pregnancy. And again, just as a reminder, this is a group of girls that are 13 to 19 years old. So in Uganda, when a girl gets pregnant, whether it's as a result of rape or sexual violence or otherwise, she's not allowed to return to school until after she delivers the baby. And usually girls don't return to school after that because of stigma around being a teen mom. Here are just a few other photos. On the right, you see that one of the biggest items of gender-based violence that they had identified is early marriage or child marriage. So the adolescent girl artist who drew this on the right shows that they're bringing all these gifts to the father of the girl. It looks like the mother or some other female relative are comforting her that she's being married off and that she's very, very sad about this. So it's really heartrending to see these things. I think even in the background, she has showed that there are children playing. And when the girls presented this photo to us, they said, you know, I wish this girl wishes she was back there playing like a child because she's still a child. You can see the girls are actually, they're standing there presenting photos like this down on the left. So that's just to demonstrate some of the roles that they played in developing this program and the focus. So here's just a snapshot look at the SAGE innovations. I'm going to a slide in a minute that will talk a little bit more in depth about those. But basically, responding to the socio-ecological model, we looked at the socioeconomic risk factors for dropout. As an intervention between those risk factors and the girls, we put in this adolescent-led early warning system, which you can see there in the middle. We used something called a stay-in-school committee, otherwise written here as SISC, and I'll talk a little bit more about who was in that. And then those activities really were kind of the shield or the umbrella in this image that were protecting adolescent girls. So we really saw in the development of this project, as you've seen in some of the pictures and discussion around gender-based violence and looking at the reasons girls are dropping out, that the adolescent girls were the thought leaders and they really helped to co-implement the project. And then the stay-in-school committee, or the SISC, were the adult advocates that were trained and equipped to be able to intervene for those girls. So built on the two theories I mentioned and the input of the adolescent girls, we developed a theory of change. And you can see that here. In essence, it posited that if adolescent girls who are at risk of dropping out of secondary school are first detected by the early warning system, and then the environment around them supports them by reducing gender-based violence and having positive norms about girl education, and that the girls are then have built the life skills that they need to really speak up and act as their own advocates, then we would be able to prevent their dropout and allow them to stay in school, which then in turn protects them from violence and HIV. So that's very wordy, but that was our theory of change that we submitted to the donor. This is a little bit more palatable. Basically, if they're identified and the environment is healthy, then they'll stay in school and their risk will be reduced. So as promised, here is a quick look. Uganda is not a huge country. It probably takes, the roads are not easy to drive quickly on, but it would probably take you about 15 hours to drive from one side to the other or less, even in traffic. So you can see here we had a few areas up in the north that we were intervening. We had some in central, which is kind of this area by the lake, and then down below in the south. So we had 3 areas and the 10 districts that you see there. All right, so getting a little bit more into what the early warning system looked like. So we looked at research as we developed this, and we noticed that there are specific ways of tracking not just the attendance for pure retention, but also looking at warning signs that an adolescent girl might be dropping out of school. So that research really pointed toward tracking 3 items, which were attendance, behavior, and course performance, which we call ABC predictors. So we looked at attendance because the girl would need to be physically in attendance. We looked at her behavior because a girl who is withdrawn or is acting out or fighting with other girls may have other issues going on with her health or with domestic violence or her grades. And then finally, looking at course performance, if a girl's course performance is very, very low, that's a red flag, but also if there's fluctuation. We looked for, if it suddenly dropped or if it went up, we could look for positive development for that girl that allowed that. So there's a lot of research behind this early warning system, both in the US and outside of the US, and we built on that existing evidence. So the project activities, and I have a little graphic in a minute, but these just in short is to, number one, we needed to establish a girls-led early warning system. So the early warning system is a physical register where each day the teacher writes down the attendance of the girl, they note their behavior, and they also look at the course grades each term. In order to put in a physical register and to have teachers filling that out, we first had to have government buy-in, so we had meetings with the Ministry of Education and the Ministry of Health around this issue. We talked to district education officials as well, and then once we got their sign-off and signed MOUs with those levels, then we were able to go to the schools to work with school administration, where we would sign agreements with the schools and then get a list of key advocates that might be at the school. So number one, maybe most important in the success of whether the project worked, was a focal teacher. So when we first went to the administration of the school, we would ask for a focal teacher to be identified who could be on point for the implementation of this project. Then that focal teacher identified teachers who would be trained on a few things. So one was positive discipline, as I mentioned. In Uganda, corporal punishment is illegal, but it's culturally accepted in most places, and in most schools, they do still use corporal punishment against students. So part of this project was to take on that issue and provide teachers with positive discipline training. And for those of you not familiar with positive discipline, this is really alternative ways aside from physical punishment. So using either positive reinforcement or, assigning students chores or, other things that can be put in place of physical punishment. They were also, the same teachers were trained on the early warning system, so how to fill out that physical register, and they were trained on gender-based violence, some of the issues from their country, globally, and then why it was harmful to girls. In this process also, I mentioned the Stay in School Committee earlier, and the Stay in School Committee was comprised of a faith leader from the community, so that might be a pastor or an imam or other leader. There could be also a traditional community leader, someone from the school admin, the focal teacher, and then any other teachers that would like to be on the Stay in School Committee. And the reason that we wanted to link both the community members and the school administration and teachers was so that there could be an integrated response to any issues that were raised as a result of this early warning system tracking. So we knew that we had to be working in the community to sensitize people as well as in the schools. And so this action body, the Stay in School Committee, was comprised of those from the school and also the surrounding community. And we found that to be very important for implementation. We also, as a result of that partnership with the Stay in School Committee, we strengthened the school community linkages. We found that usually schools were very isolated, especially boarding schools were very isolated from the community and did not involve them heavily in decision-making around what was going on at the schools. So that linkage was very important. And the Stay in School Committee also, in many cases, if there was a girl who was flagged for being at risk of dropping out based on those ABC indicators, the Stay in School Committee members would visit that girl who was at risk. So you saw in the video, there was some school administration that were talking about, well, we visited Irene or we visited Rebecca. So this looked like usually a school admin or teacher and potentially a faith leader going to the home of the girl to say, you know, why aren't you in school, or why has your attendance gone down? And if it were a family issue, which in many cases it was, the father or other family members keeping them back from school to do chores, or they wanted them to be married, then faith leaders or other community or school leaders could intervene and really advocate for that girl to be returned to school. And then finally, we did strengthen some linkages with healthcare providers for sexual and reproductive health services. So we brought in the clinic nurses and others from the nearby health clinics to do HIV testing for girls if they chose to have that test. And then we also provided referrals for other health issues as well as for HIV medication. We did a component, which if I have time, I'll show a video at the end, but we did a menstrual hygiene management training and we provided the schools with materials for that. So a lot of girls did have issues with school attendance as a result of not having menstrual pads or having illnesses that were related to unsanitary management of their menstrual cycle. So we worked with some training around that as well as providing materials. Data around whether or not menstrual materials keep girls out of school or not, I think is debated currently because the data is not, very clear on this, but the girls did tell us that this was an issue. And so again, I defer to them even beyond evidence. So as promised, I wanted to quickly show you this model so that you can see all of the different prongs. So the early warning system up to the right identifies predictors for dropout and any challenges. The Stay in School Committee tackles the challenges that are identified and they make a work plan. So the Stay in School Committee met weekly at these 151 schools and they said, okay, girls X, Y, and Z might need a home visit. This girl might need more mentorship or she might need a friend to come alongside her, etc. And then the linkages, as I mentioned, with health providers, trainings that we offered to teachers and adolescent girls, and then that school community action on the Stay in School Committee I mentioned. We had some additional activities that I think were less important, but we did them. We had some media and community campaigns around the importance of girls' education. And then we also had teachers sign a safe school contract where they committed to not perpetrating violence against children for girls. Here's just a quick glimpse at what that physical register looked like. So we developed this and we printed this for 151 schools. You can see that they had a ranking score, which I won't get into, but certain numbers signified whether that girl was at high risk or not, and they would tally up those over to the right. If any of you are interested about how that was done, feel free to reach out. I think we talked about that. So this was one of the focal teachers, and as I mentioned, that was the key point person in the school that would be on point for the project. And this is just from one of them. The effect of the early warning system is seen in many areas. She said that they felt more empowered and that their performance was improving. So some of the verbal feedback we got is that students were less afraid of their teachers because their teachers were not beating them when they were in trouble, and they felt that they could really advocate for themselves and for their colleagues. So I know we're getting close to the question and answer, so I'm just going to run quickly through some project achievements. So as I mentioned, we reached 44,351 girls, which was higher than the target that we initially intended. 99.7 were in the school according to our early warning system registers when it ended. Those that were flagged, so we did flag 2,352, and of those that were flagged as being at high risk to drop out, 94.4% were supported. We did have some girls that dropped out, and those things were beyond the control of our intervention. Here's just a couple more statistics of those who received menstrual hygiene products and other things, so I'll just skip through that. An interesting point which we found in our midterm evaluation, we really wanted to understand how girls themselves ranked the importance of the ABC predictors, and we wanted to see essentially our research question around this was, can you just track one of them? Is one of them strong enough that you would be able to identify every girl that's at risk by just using one instead of all three? Because it was a bit onerous to track all three and tally up those numbers. But we did see that a lot of the girls were ranking 2 or more factors as being necessary. They did say that coursework performance was the most significant, and they said that if a girl isn't performing, even if she's attending, but she performs poorly, that means she's not able to study at night. She doesn't have the support or the social system to really support her. So we found that interesting, that attendance was not really the most powerful predictor of dropout. A few more results before I close and open to questions. We did see some results that girls were attending school more often during their menstrual cycle. We had girls that felt more safe and protected while traveling to and from school, which is important. That was looking more at the community effects. We also saw through our community mobilization that more parents and caregivers did not want to send away their girl or boy to live with relatives instead of sending them to school. So this was a very culturally specific question, but essentially, you know, they said that they prioritized sending their children to school more after the project. We also saw that parents and caregivers had higher expectations of girls getting education, so that was positive. And we saw parents participating more in meetings at the school, so they became a little more involved with the girls' education. This just summarizes what I talked about. We did see the schools that were supporting girls who experienced violence increase, so we were encouraged by that the school, as we said, the environment became a positive learning and retention area for them. And then I think most importantly from this longitudinal study, as I mentioned, gender-based violence and school-related gender-based violence, which is the corporal punishment by the teachers, we saw a decrease by 5.6% from the school-related gender-based violence in 12 months, and then in the last 6 months it went up to 7%. We saw a huge decrease in corporal punishment, so that was very, very important, a decrease of 17.1. So that positive discipline training for teachers was effective. And then corporal punishment reduced as well with that. So we also saw, this was an interesting result of the study, and it showed that more individuals were reporting underage marriage. It jumped to 45.3% higher, that people were actually reporting underage marriage. And so when we first saw this, it looked really negative. It looked like there were more underage marriages happening, but we realized once we dug into the data and the responses that people were just more comfortable reporting it. They'd realized that it's wrong for girls to be married when they're under 18, and that it should be reported, and they understood how to report that. So we were happy about this, but it was also, it's discouraging to see how underreported child marriage was. We had some gender equality respondents. So for example, one that was interesting is at the bottom, 17.3 agreed that both boys and girls should receive the same punishment. Often they did not believe that. And I'm going to skip over these just because of time. Again, those who'd had sexual intercourse at young ages had decreased. So that showed that we'd raised awareness around the importance of having safe sex or abstaining if they were unable to do that. And then just quickly to close, the lessons that we learned throughout these 2 years of implementation was that the early warning system does work. It takes a lot of commitment from staff and government, but it's very, very effective. So we're looking at scaling this up in Uganda, both in primary and secondary schools. We also saw this was a pretty low cost project at 2.2 million. And so we saw that it's low cost and feasible, but it really requires a lot of heavy lifting by school administration and teachers. So that is an issue. We noted that in the responses where girls did drop out, it was usually that they didn't have school fees. And in Uganda, if you're not paying school fees, they kick you out and you are not allowed in. So that was really, it's a government policy we hope will change. But for now, that's one of the biggest barriers. So looking at cash transfers might be helpful in the future, which we did not do. And then in the menstrual hygiene management, we did engage boys in some of those trainings, and it was really interesting to see adolescent boys learning to make menstrual pads, and they said they were going to take them home to their sisters and give them to their classmates, etc. They were really excited that they could help with that because they knew that it was an issue for their female colleagues. And then just community engagement we saw was very important, that all of those different stakeholders were involved. We have a few minutes here, as I mentioned, for questions, so feel free to type your question or to speak out. If you type your question, Kelly will read that to me just so that I'm not switching around. But please feel free, we'll open it up. Thanks.
Thank you very much. It was a very interesting discussion, and I hope we have some really good questions for you now, Julie.
Thanks, Professor Green.
So Julie, this is Mary Nielsen, and do you work at all with Melinda Gates, or have you been in contact with her? Because this is exactly what she's doing worldwide, and what a resource of financial support she could be for you. But in reading her book and doing a lot of her and her husband's studies, this is what they're doing in Africa. Also focusing quite in-depthly on in-home domestic violence. But do you have any contact with her? Are you working with her at all? Or and then,
yeah, thanks for that question. Yeah, go ahead.
Well, just question number 2 was, my husband and I would be very interested in talking to you. Is this something that you plan on taking across the country? We make regular trips for medical mission to Tanzania, and would love to see a project like this happen over there.
Yeah, absolutely. So for question number 1, the Dreams Innovation Challenge was in part funded by the Gates Foundation. I didn't work at any point with Melinda Gates or the foundation directly, since it was a PEPFAR managed grant. But I do know that World Vision does have grants from the Gates Foundation that may or may not be related to this. I have not worked on one of them, but that I think is the situation. I'd love to speak to them about rolling this out more fully, but I don't have that contact. And to your second question, certainly I think we're pursuing a lot of different avenues around expanding this within Uganda and elsewhere. So we currently have a proposal out to scale this up in 4 countries nationally from the MacArthur Foundation, which is $100 million to do national early warning systems and gender-based violence reduction. So very, very hopeful about that. And we'd love to get funding to expand it. Currently, I think we're using our private funding in Uganda to roll it out in primary schools.
Excellent. Thank you very much.
Sure thing.
This is Annie Lynn. This is great, and you presented some really amazing results, and I'm wondering if you can speak a little bit about some of the challenges that you faced in this project.
Sure. Yeah, no, that's a great point. I think getting this off the ground was really difficult. I mentioned that stakeholder buy-in took a lot of time. So we initially had 2 years for the grant, and we ended up running over that timeline because it took about 6 months to get contacts in all the schools. We also, because there was no national data on secondary school retention for adolescent girls, we did not calculate how many would be in each school. So we initially planned to be in around 120 schools, and we had to expand that to 151. So you can imagine that that's a lot to add in terms of staffing and coverage for that many schools. The biggest issue that I would say is that we did not build in cash transfers, and the girls really, really needed cash transfers. If the government policy is that you get kicked out of school if you don't pay, and your family is very, very poor, then you get kicked out. There's, even if you have the school and community working together, if your family is just too poor to pay for that, then they can't return to school. So we did have a lot of sponsorship that we tried to get in place. We tried to mobilize communities, or to get the parents to really prioritize their girls' education. But some families had like 8 or 10 children, and they had to choose which kids went to school because they couldn't afford it for all of them. So I think that was our biggest challenge.
Hi, Julie. There's
I'm going to take this couple. Yeah, go ahead.
There's several questions in the chat. So we have the first one from Abby. Knowing now that course performance is such an important dropout indicator, how would you change interventions?
Yeah, that's a great question, Abby. Thanks. I think that we would look a little bit, I think we were really focused on retention and a little bit less on mentorship in the project. So we did have some mentorship components where we would have peer-to-peer support from some peer leaders that we built up skills for. But I think we would really emphasize that. So the peer educators could work with girls that were lagging behind or struggling in different subjects, or they could help them to speak to their teachers if they were struggling. So I think really working with teachers to understand, to build on what we did for positive discipline, but also to make sure that there was peer support for girls that were struggling with performance would be really, really helpful. And we just didn't have the time or the number of peer educators to do that. So one of our learnings was that we should have had about twice as many what we called peer educators who were trained in leadership skills, and they helped to advocate for their peers. So I think that would respond to that one. And I'm just going to actually go through the questions I have here from Lauren. Thank you. We had refugee populations that were attending some of the schools, for example, in Rakai, and up north in Gulu and Lira. But we didn't work in any of the refugee camps with this particular grant. World Vision does have education programs and other programs that are serving refugees in Uganda, but this particular project worked in established government schools, so it was beyond our scope if those refugees were not there. And then Summer has asked, What do you do if you go for a home visit and the girl's father doesn't want her in school? That's a really good question, and we actually had some big conflicts between parents and school administration. And usually what would work best for this is to have a faith leader go to speak to the father. So that's why it was important to have traditional leaders and faith leaders on the Stay in School committee, because they had a lot of tout in the community. So if it didn't work for the principal or the teacher to speak to the father, sometimes the faith leader would go and from a faith standpoint say, you know, you need to value your daughter, you know, make sure that she has the best upbringing and education that she can have. And that would often work. But there were some cases where the father would not listen to anyone. And we, unless there was an issue of child marriage that could be reported to police because it was illegal, then there's a limit to what can be done if they simply won't be convinced. I know of at least one that would not physically let the father take the girl from the school. So the administration, you know, put her in their office and they said, you can't take her, you know, she's staying here. And that was a situation where they knew she was going to be married. You know, he was taking her home specifically to marry her off. So they said, we're keeping her here, and if you take her, we're going to report you, essentially. So there was a lot of that going on. I know I didn't listen to each case where this happened, but it was definitely an issue. See another one from Abby. Did the type of school make a difference in HIV and retention? So I don't have this in the data. I can speak to this a little bit just based on my experience. I think that the boarding schools did so the girls-only schools had the highest retention, and they were also the most bought into the program. So usually the girls-only schools were very, very successful, especially with gender issues, obviously, because you didn't have the mixed genders. And I think some of our top performers were Catholic girls-only schools. All of the schools that we worked with were public schools. They were all government schools. And again, yeah, the boarding schools for girls that were Catholic, I think, were some of our highest performers. But again, I don't have that in the data. I just know it from the ones that I physically visited. And yes, there were districts. We can definitely see retention when it's compared in districts that those in the north that were affected by all of the war and conflict, civil war, et cetera, and coming over from the Congo, that conflict made people in those communities a lot less trusting of each other, including trust between teachers and the students, trust between faith leaders in the community, even trust between different community members. So we saw that there was a lot less school retention in those areas, and the reasons for dropout were usually skewed a little bit more towards the gender-based violence. And then I see from Lauren, oh, thank you. Thanks for sharing that. I love hearing when other people do the same. And then Phyllis is asking, how did you get the stakeholder buy-in and sustain community involvement and peer-to-peer support beyond the project? So stakeholder buy-in really went from top to bottom and then bottom to top. So we first had to get sign-off from the government that we were going to be doing this grant and that they would agree that it would be allowed in the schools. So we had to go to the Ministry of Education. At the very top level, the Minister of Education, I think, was involved, but because it was a PEPFAR grant, they're a lot more willing to work with US government money. There's a lot of projects going on, and usually they're accepting of that. So then once the Ministry of Education signed on, we were able to go to the district Ministry of Education officials and then, you know, talk to them about the importance of this and get their buy-in, as well as, you know, essentially inform them that their leadership was supportive of this. And then working the other way, We had orientation sessions with school principals and teachers and adolescent girls. So it was really a lot of orientation and building buy-in at many different levels. And one of the things that worked really well, at least for working with the girls and the schools, was we hired our field officers from the communities where the schools were. So they were local people who knew everything about that school, maybe even went to that school, and they were able to really understand the context of where the school was located in the community. And so they were the best advocates. They really did a lot of that work. The community involvement, so sustaining beyond the project really was up to the school administration. So we did have some cases where schools began to budget for menstrual hygiene materials to make reusable sanitary pads that we had introduced to the school. We did have also the peer system stay there, and we had schools decide to keep the early warning system as part of their school attendance tracking. Currently, there are policies being worked out at the national level to replace, there were at least discussions as the project ended, I don't know how far they've gone, but to replace the simple attendance checklist that they use in a lot of schools to the early warning system so that they had more data. And we even had one school principal that said, I'm able to see, I can grade or assess my teachers based on how much dropout or attendance they have in their class. So if you see, you know, this student attends all her classes, but she never attends Mr. Smith's class, maybe I should talk to the girl and understand why she doesn't attend that class. And if it happens to be that that teacher is harassing her or uses corporal punishment or something like that, he actually sort of flipped it and used it as a teacher management tool as well. So I thought that was interesting. And then I see one last question from Abby, which is, did an educator's education background make a difference in their ability or the effectiveness? I do think that sometimes even where the teacher was from was important, but we noticed that the liberal arts teachers tended to sort of accept this and appreciate it a little more. But again, I don't have any real data on that. It's just based on my discussions. And usually the focal teacher was, you know, like the English teacher or the liberal arts or, you know, whatnot, that they would choose someone who was really invested already in the girls' education. We had a few that were men, but most of them were women as well, the focal teachers. So that was an interesting dynamic on gender as well.
Well, Julie, I got two questions for you. I was so many questions, I didn't get a chance to ask any of mine yet. So sure. The first one has to do with teachers. Actually, it's a follow-up. You know, I think one of the things that I got out of your presentation was the importance of safe schools and the importance of the role that teachers play. How did you bring about behavioral change among the teachers? I think that would be an important part of your project.
Yeah, absolutely. So there were a few ways that we did this. Number one was just training and sensitization. So we did train them on positive discipline, and we trained them on the importance of attendance. So you saw in the video that there was a male teacher saying, oh, well, we never thought twice when a girl dropped out. We didn't understand how that was going to affect a girl's success as an individual and as a student. So some of it was just really showing them the data and, you know, having a training session where they started to understand how education can really help a girl to be successful in life and to protect herself. So in a lot of cases, it was just a matter of not knowing that this was as big of an issue. And part of it was that the teachers were really not making the connection between the girls who weren't showing up in class and their future or their safety as an individual. So making those connections, I think, was important, and then also getting government buy-in, because it's a very sort of hierarchical society, I would say. So if your Ministry of Education or the school principal is bought into this idea and this concept, then it's a lot easier to make the case for teachers that this is important for them to work into their curriculum. And then finally, I would say, some teachers were really resistant to try the positive discipline, and we said, you know, just try it. Like, try this out for a week and see how your students respond to you. And once they began to see that, you know, students who weren't afraid of them were coming to them, asking for mentorship, asking questions, they had classrooms that were more engaged, then that really spoke for itself, and it really led them to be invested in the project itself. And then we also, as I mentioned, had peer educators. So these were girls who were trained in life skills. They were trained in, you know, HIV prevention and the importance of education and prevention of GBV. And so they sort of, as a cohort, the cohort of peer educators became more confident as they got this training. And so they would go to the teachers to advocate for their peers or for themselves. And I think the confidence and the change that they saw in those peer educators really, you know, spoke to the teachers in an important way, that they could see like a living example of a girl who's, you know, furthering her education, et cetera.
Yeah, that sounds great. So my other question is, and I was talking about this in my class today, in my global health class. One of the things we were focusing on is what lessons are learned from work in places like Uganda that you can bring home. What would you say you learned from this whole experience that you could recommend that we could do better here in the United States based on your experience in Uganda?
Oh, that's an interesting question. And it's also a strange dynamic with COVID right now. I think probably my biggest takeaway is this positive youth development framework that I discussed at the beginning. So that's really like where whatever decisions you're making about an adolescent or a child should really involve that adolescent or child. I think often we see in our public schools, especially in the United States, that a lot of decisions are just made by administrators and made by teachers, and curriculums are developed without any input or review from students or children. And this is problematic no matter what context you're talking about. And in the US, we're equally as guilty of that. I think there are a few education exceptions that really consider youth as active participants in what they're learning and doing. But for the most part, we just dictate down to them what they should learn and how. So it worked really well because we had adolescent girls involved at every stage. And I think similarly, we could take that on in the US as well.
Thank you. Well, before we open it up to applause, I'd like to call on Kelly to tell us what's going to be happening next week.
I don't have the title of her talk in front of me, but next week is Sam Croft, or Twigs. Hold on one moment. And she is talking about crisis competency, specifically, of course my computer freezes up as I try to switch screens. Specifically how environmental damage from, there it is, crisis competency, understanding the public health consequences of modern military crisis.
Okay, thanks. That's certainly something we'll want to tune into. So I want to just, Julie, I want to say a couple of things. One is how proud I am of you and the work that you're doing for globally, and that to some extent at least we can take some credit here at the University of Montana for having given you the kind of background that enabled you to go forward and do these wonderful things. So congratulations on that. I wish you all the best as your career goes forward in the future. I think you've accomplished some wonderful things already, but there's a lot more coming up. So please do your best and stay healthy so that you can do all of those things as well.
Yeah, so thank you so much, Professor Kern. It's a pleasure to speak here, as I mentioned, and that UM definitely was the foundation for any of this. So taking it with me.
All right, so I'm going to ask all of you to unmute and give your thanks to Julie for her presentation tonight.
Julie. Thanks, everyone.
Okay, go well, everybody. See you next week.
Take care. Bye.